From New York City, this is Nightline with Dan Abram.
The Affordable Care Act will still roll out as planned. Love it or hate it, Obamacare won't change some fundamental issues with American health care, like some companies giving employees the option to go abroad for cheaper medical care. Already nearly 1 million a year travel out of the country for necessary procedures, and there could be more now. So could this become the new face of health care? ABC's Byron Pitts investigates.
This is my family. They're all going to the airport with me. I have everything.
Tonight, Joy Guin, age 39, married, mother of 2, is on a journey.
Let's load them up, move them out.
Leaving Hickory, North Carolina to save her life and not kill her family's savings.
I'm going to miss my family a whole lot. So, and I'm like scared.
With a family history of diabetes and heart disease,
This is my baby.
she's going to the only place she can afford gastric bypass weight loss surgery.
I want to leave.
Her destination, Costa Rica, a tourist hotspot and growing in popularity in the booming business of medical tourism. For Joy, it will be the adventure of a lifetime, a 10-day trip, and get this, all of it paid for by her employer.
I guess this is it.
Joining her on the trip is Gary Harwell, 65.
I just want it to be over so he won't hurt so bad.
A retiree from the same plant where Joy works. Gary's going for knee replacement surgery.
Your first plane ride.
I know. I'm so excited. Yeah.
Good.
I am.
Everything's well.
Yeah. Yay!
At 283 pounds, Joy has severe chronic obesity. She wanted surgery for years, but with an annual salary of $28,000, even with insurance, she couldn't afford the out-of-pocket expense.
Yes, it's all because of HSM.
Could you have afforded this procedure back home?
No.
No chance, no how.
No.
Gary's wife works, but with him retired, he was prepared to live with severe knee pain.
How does your wife feel about you coming here for surgery?
She's ready for me to get things taken care of.
So it's that important to you to get this done?
Yeah, very much. I feel like I'm slowing her down a little bit, you know, and I'm slowing me down because I'm not able to do the things that I need to do.
Both did their research. Gary's surgeon, Dr. Oscar Oding, earned his medical degree in Latin America and received additional training in the U.S.
I ask this question respectfully. How does your training compare to an American physician?
I don't want to be compared with them at all. I'm just another option.
Joy and Gary are part of a growing wave of Americans frustrated by U.S. healthcare costs, the highest in the world, and traveling abroad for cheaper, more affordable medical procedures. But here's what's new. Their company back home in Western North Carolina, HSM, is paying the entire bill.
This is beautiful.
Everything. 4-star resort hotel where they'll stay for at least a week. And then there's the personal driver.
It's beautiful.
A built-in best friend, what's called a patient assistant, along to fill out forms, answer any questions, including translations.
When you say Buenos dias?
Buenos dias. It's good morning.
Oh, okay.
And the love doesn't stop there. A private room in a private hospital with a pull-out bed for guests. And the pampering even comes from the surgeon, who offer reassurance in one of the many scheduled consultations.
You came by yourself or you have somebody here?
By myself.
Okay, don't worry. We'll be your family here.
Exactly.
Yes, thank you.
It was enough to move Joy to tears. In the U.S., Gary's knee replacement would have cost more than $50,000. In Costa Rica, it's half that. Back home, Joy's gastric sleeve surgery goes for about $30,000. Here, less than $18,000. In the U.S., Gary and Joy would have each paid $3,000 out of pocket. In Costa Rica, nothing. Their employer says it just makes economic sense. So far, the company sent close to 250 employees abroad for surgery. HSM executive Tim Eisenhower.
The fact that you've decided to give your employees as an option the chance to go abroad for health care, what does that say about the American healthcare system?
American healthcare system, quite frankly, is broken at the moment. You know,
Broken how?
The error rates are probably the highest in the world. The cost is also the highest in the world.
What will Obamacare mean, you think, for medical tourism? Increase it, decrease it?
I think it'll increase because companies will be looking to reduce costs.
So you expect this surgery will change your quality of life?
Certainly, without a doubt.
Joy and Gary could back out at any time. but they're going through with it.
And what have your friends said when you've told them that not only am I going to Costa Rica to have this procedure done, it's going to cost me nothing?
You lucky dog. She's like, really? Who do you work for? I wish that we was offered stuff like that.
Did you sleep much?
Yeah, as a matter of fact, I slept very well.
Day 3.
It is 4:55 a.m., way early in the morning, and Gary's headed to the hospital for his surgery.
There they are.
And waiting at the hospital door is Gloriana Gomez, Gary's patient assistant.
Morning. How are you?
A kind of personal escort.
Take a ride again.
His knee surgery will take nearly 2 hours.
That heavy structure is not normal.
We noticed during Gary's procedure, much of the equipment, including his new knee, is actually made in the U.S.
We saw that in surgery. There are certain pieces of equipment they were using in the operating room in Costa Rica, made in the United States, but it was cheaper for them to purchase it in Costa Rica than it is to purchase it here at home.
Exactly. Prime example, just last week we had a hospital in Texas, 2 partial knee replacements, $90,000 for the 2 devices alone. So in Costa Rica, that's probably, what, $3,000 for those devices. Big difference.
So the economics, you just couldn't ignore.
Can't ignore it.
Surgery is done, Gary.
After successful surgery, Gary heads to recovery. About that time,
Yes, I am ready.
Joy shows up for a gastric sleeve surgery. And that's when we heard another American voice. There next to Joy is Faye Holmes. She and her husband moved to Costa Rica from Northern Virginia, in part because of the cheaper quality health care here.
You were talking to friends back in the States and they were considering going abroad for surgery. What would you say?
Well, I would ask them first what hospital, and then I'd say that's a really good idea.
What were you about to say?
Hell yes.
As for Joy,
You're in the recovery room. You're fine.
her procedure also goes well. Remember, all of this at their employer's expense. And yet there's one more bonus. When the bandages come off back home, each will receive a check from the company for at least $2,500, a percentage of the money saved in insurance cost.
You're in a beautiful location. The procedure for you will be free, and you'll get money back. That sounds like a win-win for everybody.
It is. It has to be. It was, as I've said all along, it's just kind of a no-brainer.
But medical experts who are tracking the increasing number of Americans, now more than 1 million, going abroad for medical procedures, are concerned.
The biggest risks are an inability to sue for medical malpractice if something goes wrong, risk of getting an infection while abroad, risk of a poorly performed procedure.
Tonight, Joy and Gary are still recovering at their resort hotel in Costa Rica. Daily visits from a private nurse, access to free cell phone service to call home, and co-workers anxiously waiting for a recommendation.
Even though it's for my health, that's my benefit out of it. And then the rest is to help us all. You know, it's a wonderful thing, especially, I mean, Christmas is coming right around the corner and other things, so it's all like a win-win situation to me.
For Nightline, I'm Byron Pitts in Costa Rica.
Getting paid to go abroad for medical care, tough to compete with. Thanks, Byron.